Medical professionals of Reddit, when did you have to tell a patient "I've seen it all before" to comfort them, but really you had never seen something so bad, or of that nature? Years ago my then 11-year-old shattered both femurs and her hip. At the time, her orthopedic specialist was so reassuring and confident that we had no doubts about her recovery. A year later, we went back for a review and he asked me if I'd like to see her trauma x-rays. Not having any idea of the reality, I said yes. What I saw looked like her leg bones had exploded. After my freaked out reaction, I commented on how cool and calm he was, and how certain that she'd be fine. He said he'd actually had to go for a short walk around the hospital to collect his thoughts since he had no idea how he would put this child back together. He also told me I'd use the films as a teaching aid. He's one of my heroes. Had a guy that shot himself under the chin with a shotgun. He had actually done it like 16 hours prior to family finding him. He was still alive, conscious and alert to what was going on. His jaw looked like Predator. I had family freaking out, of course. Had to tell them we see worse often. Which may be true, but they are usually dead. He lived for almost a day after shooting himself, then died in the back of my ambulance. I work in gynecology and I had to chaperone a male doctor for a pelvic exam. Patient was complaining of pain and discharge. Her vaginal area was completely red and swollen. He then so gently inserted the speculum to get a look, and immediate white cottage cheese-like substance comes pouring out onto his lap and hits the floor. Imagine dropping a container of cottage cheese on the floor. We stare in disbelief. He then had to remove the speculum and use it like a spoon to scoop out more discharge just so he could get a look inside. He tells her it's a yeast infection and she'll be good in no time with the prescription medicine. That day I learned if you smile while humming it helps in suppressing your gag reflex. Edit, thanks for the silvers. Edit 2, gold. Thanks so much. As a medical student doing my first placement in the emergency department, I was waiting outside the triage room to ask the nurse something. I was the lowest ranking, most clueless person in the department. I knew a lot about the Krebs cycle, not a whole lot about, medicine. A young man came up to me and said he was sorry to disturb me, he just wanted to check. It was just, not to queue jump or anything, but he wanted to check, can this definitely wait for triage? He then unwrapped a towel from his hand and showed me his thumb, which he had dropped a loaded barbell onto. It was shattered, just flattened, with splinters of bone coming out. I stared at it. He stared at it. I stared at it. Then I told him, oh yes, no problem at all, he'd better take a seat and I'd make sure someone was with him right away. Lady came in with possible stroke symptoms, numbness, weakness, difficulty speaking, Gale abnormalities. CT brain unremarkable. Lab work was really odd. We were thinking cancer, so we decided to CT her chest and abdomen as well. Turns out she had a dissection the entire length of her abdominal aorta and going into her right femoral artery. Left femoral had an aneurysm and was beginning to dissect as well. She had formed a massive clot throughout her abdomen that was miraculously keeping her alive. Basically all of her organs were ischemic, dead. About 5 different teams showed up in the ER to see her. After hours of discussion, the consensus was that there wasn't a damn thing anyone could do. We sent her to hospice. Edit, Eli 5 in a comment below, please don't give me any more gold or silver. Take that money and make a donation. If you don't know where to donate, consider American Foundation for Suicide Prevention, https://afsb.donordrive.com index.cfm. Fusey action donate.general. Posted this before, 4th year med student here. On my rotation a couple months back, I walked into the ED and was immediately asked to help a nurse and resident put a catheter in a patient. Now a catheter placement is usually a one-person job, so I was pretty confused as to why they needed my help. I walk into the patient room, and am immediately greeted by a disgusting rotting flesh smell. Worst thing I've smelled in my life. The patient has to be pushing 400 pounds and has the worst edema, soft tissue swelling, from congestive heart failure I've ever seen. His scrotum and penis foreskin are about the size of a small watermelon, and the foreskin had swollen completely over the tip of his penis. The nurse had a speculum, two lobgins used to look inside vaginas, inserted into the man's foreskin while the resident took the catheter in a hemostat, pliers type thing, and jammed it into the man's pee hole for 20 minutes. They finally got the catheter in and took the speculum out. It was covered in a thick brown discharge that looked like fermented piss shit. I still don't know how he let his scrotum and penis swell that much. Edit: we comforted the patient the whole time and kept telling him we had done it like this before. Total lie. No one in the ed had ever done or seen anything like it. Genital warts the size of grapes on the guy's dick. Quoth he, the ladies never complain. I'm an RN who specializes in wound care. We see a lot of crazy things in my clinic. A common occurrence is a pilonidal cyst, which is an abnormal growth in eugluteal cleft, aka butt crack, that contains hair. It usually happens with younger PPL, say 1320s, and is obviously very embarrassing to the patient. When we get them, they've already had the surgery to open and extract the cyst, so there's a few holes left that we have to heal. One poor soul that came in had the worst post-surgical hole I've ever seen. It was so big, it extended from the top of her crack to the top of her anus, then are on either side about 12 centimeters. It was like the surgeon carved out most of her butt. The patient was devastated, and I tried to comfort her by telling her she's not the worst I've ever seen. Poor girl. Edit: so many comments. I just wanted to add that if this is something you haven't gotten it checked out, please do. Also, if you have to have surgery, make sure it's the Bascom procedure. If your surgeon doesn't know how to do it, find a different one. You may have to travel far to find one that does it, but it's worth it. Lots of stories, many already covered by others. I will share this particular story with my legs crossed. Motorcyclist came in after someone left-turned without checking. He had gone over the hood, slid and somehow somersaulted, landing on his ass sitting up. He slid across intersection mostly on his ass, getting serious road rash. Luckily he was only a block from hospital and ambulance. They pack him and bring him to the ER. We end up cutting off his chaps and jeans and begin the cleanup of gravel and sand embedded in his thighs and ass when all of a sudden, his testicles fall out of his scrotum. He had basically sandpapered a hole in his scrotum while skidding on his ass. The attending pauses, grabs the saline, irrigates scrotum and nuts, fondles them back into place while humming. I handed him some gauze to pack the wound and smiled at the patient who was under a local. Then I went on break, went fetal and dry heaved. Edit: thank you for my first gold. In 2011 I had a saddle pulmonary embolism 2 weeks before my scheduled wedding. My quite seasoned heart surgeon seemed pretty confident that I'd be okay, and he even said he'd get me to my wedding on time. Long story short, I was in the hospital for about a month due to complications. Several weeks later, when I was visiting my heart surgeon for a follow-up, he told me he'd only ever seen 2 other people as sick as I was. Those 2 didn't survive. Paramedic here. Had a homeless guy call saying he stepped on a nail about a year ago. I could smell it from the door, so I expected it to be bad, but when I went to pick up the leg by his heel there was just nothing there. His foot just evaporated into pus and maggots and his metatarsals clinked through my fingers. While I'm standing there trying to comprehend what happened, he just sighed and asked me to pick up his foot. What foot, buddy? Put it back on. He said it falls off a lot these days, but it still hurts, so that's good, right? I had no clue what to tell him. The nurses thought it was hilarious that the baby medic, that's me BTW, got grossed out. Edit: yay, my gold cherry has been popped. I'm a baby medic no longer. At least on Reddit. Had a patient who needed a lower GI study to fix a bowel bleed. To get a study done you need to poop clear mucus. 3 days we bowel prepped with heavy laxatives and enemas. He barely pooped anything. He puts on the call light at 6:45, 15 minutes before my shift ends. He calmly says, "I kinda wanna try and poop." He said it so casually I figured he was going to toot out another gas bubble and walk back. He stood from the bed, took one step, and the floodgates burst. 3+ days of the most rancid liquid stool I had ever encountered. It just wouldn't stop. He left a river of stool from the bed to the bathroom, coated the walls as he bent to park his butt on the toilet, and continued to dump out 7 people worth of poop. In my 9 years I have never seen that much come out of a person. He was not a large man. He was so embarrassed, but I just kept my face as solid as possible, grabbed half the linen closet and 3 packages of Cavi wipes, and sopped it up. Told him this happens all the time. Edit, thanks for my first gold. Edit to my edit, thanks for my first platinum and all the kind words. I love what I do.